What are the stages and progression of Parkinson's disease caused by ATP13A2 mutations? What happens when Parkinson's disease is linked to mutations in the ATP13A2 gene? This specific form of Parkinson's disease, also known as Kufor-Rakeb syndrome, presents unique challenges. It typically begins in adolescence or early adulthood, which is earlier than the more common forms of Parkinson's disease. The initial symptoms often include tremors, rigidity, and slowness of movement, which respond well to treatment with levodopa. However, this form of the disease also shows some distinctive features. In the early stage, patients may experience not only the typical motor symptoms but also pyramidal signs, which can include increased muscle tone and reflexes. Cognitive issues, such as difficulty with movements, can also begin to emerge at this stage. As the disease progresses into the intermediate stage, motor symptoms worsen, leading to increased difficulty with movement and balance. Patients may develop additional neurological features like involuntary muscle contractions and spasticity. Cognitive decline becomes more noticeable, and psychiatric symptoms, including depression and psychosis, may arise. In the advanced stage, the situation becomes more severe. Patients often face significant motor disability, which greatly affects their ability to perform daily activities. The neurodegeneration extends beyond the substantia nigra, impacting various brain regions and leading to further cognitive decline, which may progress to dementia. Autonomic dysfunction can also complicate the clinical picture. The underlying mechanisms of this disease are tied to the ATP13A2 gene mutations. These mutations impair the function of the ATP13A2 protein, which plays a crucial role in maintaining lysosomal and mitochondrial health. When this function is disrupted, it leads to impaired lysosomal autophagy. This means cells struggle to clear out damaged proteins and organelles. As a result, abnormal accumulation of alpha-synuclein occurs, forming Lewy bodies that contribute to neuronal death. Mitochondrial dysfunction further exacerbates neuronal vulnerability, driving the neurodegeneration seen in ATP13A2-related Parkinson's disease. Diagnosis typically involves genetic testing, clinical evaluations, and neuroimaging to assess brain function. While the disease initially responds to levodopa, patients may later experience complications like motor fluctuations. Currently, there is no cure for this condition. Treatment focuses on managing symptoms with dopaminergic therapies and providing supportive care. Research into ATP13A2 mutations is ongoing and aims to shed light on the disease mechanisms. Understanding these mutations may lead to identifying new therapeutic targets that enhance lysosomal function or prevent the aggregation of toxic proteins. This knowledge is essential for improving diagnosis, management, and future treatment options for those affected by this rare form of Parkinson's disease. Always consult healthcare professionals for personalized medical advice and treatment options.